Oh, hi. Welcome. You must be my next patient. Come on in and have a seat. Sorry, I'm just getting my hands cleaned up from my last patient. Let me see here. Oh, we have you in for a cranial nerve exam. Wonderful. Well, tell me, did you hit your head recently, or is this just routine? Just routine. Fantastic. Well, have you ever had a cranial nerve exam before? Well, it's a very simple exam, and what we do is we test all of your senses. So that would be your sense of taste, smell, sight, hearing, and touch. All right, so take a seat. I'm going to throw on a pair of gloves real quick. And do I have your consent to touch you during this exam? It won't be too much and it won't be intrusive, but in order to be thorough, we do need to make sure that we can truly test all of your senses. Great, thank you so much. So any other problems that have been going on, or you feeling all right? Feeling generally okay? How's your mental health been? Good? Good, glad to hear it. You sleeping okay? Getting at least 6 to 8 hours? Let's see if we can get those numbers up. I mean, 6 is okay, but it's not ideal. But we can work on that. Alright, so to start off the exam, all I'm going to do is first give you a quick visual inspection. Just look all around your face, just looking for anything that might be out of place, anything that is a glaringly obvious problem, which I'm not seeing on your face so far, which is great. Just gonna go ahead and turn your head to the side for me. Just gonna look over here. Take a look at those ears. Yeah. Okay. Same thing, other side. Turn your head a little bit. Let me see. Okay. Alright. And this forehead of yours. Your skin looks very nice. You must stay well hydrated. This is very important for healthy skin. Very, very important. Good job. Okay, stay still for me. I'm just going to stand up and look through your hair real quick, just to make sure I'm not seeing any kind of contusions or anything. So stay still for me. Okay. Just looking through your hair here. Not seeing any major issues. Good. Great. Well, now that that is done, I'm going to just come a little closer, and I'm going to be touching your face a little bit, just feeling around your facial structure, making sure I don't feel any kind of contusions, no minor fractures or anything like that. So we're going to press on those temples, and press. Good. No pain. Good. Don't want any pain. And on your forehead here, I'm just going to percuss. Any pain there? Good. Your T-zone right here. Going to just run my finger down that. Let me know if there's any pain. I know it's kind of an odd sensation, but any pain. Good. I'm going to press right on your eyebrows here. So press. How's that feel? Good. All right. Back to the T-zone. Down. Any pain? Good. And I'm going to just palpate on your eyes and along your sinuses. Any pain? Good. Press a little bit deeper. Good. And I'm going to come up here and press on your temples just a little firmly. Press. Any pain? Good. your neck for me a little bit. Just want to look under there. Okay. Not seeing any major issues, no obvious swelling. Come for me. I'm just going to feel under your jaw. Just feel around. Make sure there's no swelling in those lymph nodes there. Good. Just keep that neck up a little bit. Good. 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 Alrighty. Well, why don't we start testing some of those senses of yours, shall we? Let's start with the nose. Make it very, very easy. So, what I have here, little spray bottle, is a scent. I'm going to spritz it, just like you would spritz maybe perfume or cologne. And I just want you to smell it and tell me what you smell. Alright? Alright, so close those eyes for me. And 1, 2, 3. What do you smell? Citrus. Very good. Let me get another one. Keep those eyes closed for me. And 1, 2, 3. What do you smell? Coffee. Very good. And one more. Keep those eyes closed. And 1, 2, 3. What do you smell? This one might be a little tricky. Vanilla, very good. Alright, go ahead, open those eyes. With your sense of smell intact, I'd say that your nose is pretty good. I would like to take a quick look up it just to make sure everything's good inside. So if you wouldn't mind leaning your head back for me, I'm going to take a look inside that nose of yours. My little otoscope here. So just lean back. And good. And the other nostril. Good. Very good. Alright. Now I would like to move on to your mouth and your sense of taste. But before we get to the taste test, we're just going to do a brief oral examination and jaw examination just to make sure everything is in tip-top shape. Alright, so get straight at me. Coming back under, gonna feel that jaw, but this time I want you to look at me, clench your teeth real hard. There you go. Just gonna feel behind that jaw, clench again. Want to feel those muscles tighten up. Good, now relax. Good. Feel you. Now I'm going to feel your neck. Hold inside your throat. Why don't you swallow for me? 1, 2, 3, swallow. Good. One more time. 1, 2, 3, swallow. Good. And then up under the neck again. Just want to feel those lymph nodes. Make sure nothing is swollen, popping out. Not where it should be. You know. Good. Wonderful. Alright. Now, I would like you to open that mouth for me and say, ah. We're going to take a look inside, and we're going to take a look at your teeth, look at your tongue, look at your throat. Okay? Alright. So, say, ah. And quick peek inside. Quick peek. Okay? And now we're going to look a little bit deeper in. No traditional tongue depressor anymore. We've gotten a little bit more adept with our medical equipment. So now we have our metal one. Does not go so far back. Will not make you gag. I promise. So open, open, open. Say ah for me. Hold out that tongue. Just gonna look back at your uvula. Make sure I'm not seeing any white spots, no sign of any kind of growth or things that shouldn't be there. Good. Good job. I know, just a few more seconds. Great. You did wonderful. Alright. take a look at those teeth real quick. You brush your teeth twice a day? Good. Dentist every 6 months? That's what I like to hear. Any major oral procedures lately? Great. So this should be great. Open up, say ah. I'm just gonna stick my eye aside and take a little peek. Yeah. Just look at those teeth. Nice pearly white. Good. Good job. Look at you. Keep up with that oral health. So proud. Alright, my friend. Well, let's get on to that taste test. So this is very simple. I'm going to ask you to close your eyes, stick out your tongue. I will place a drop of a liquid on it, and you tell me what you taste. Alright. Close those eyes for me. Stick out that tongue, and 1, 2, 3. Drop. What do you taste? Coffee. Brilliant. Keep that tongue out and those eyes close. And here it comes again. Drop. What do you taste? Lemon. Very good. Keep those eyes closed for me. Tongue out, and the last one. Here we go. And what do you taste? Lavender. Very good. A lot of folks do not get that one. Well, your sense of taste and your sense of smell are very much intact. So we can do your touch, your eyes, or your ears next. Why don't you pick? You can go with the eyes. Alright, we can do that. Alright, so we're going to start with the vision portion of the eye exam, and we're going to do a couple of eye charts. The first one is going to be our number chart here. So you just tell me what number this is. This. Good. Great. Wonderful. Good. And then we are going to move on to a more traditional eye chart here. So with both eyes open, please follow my finger and read along. Good. Now I'd like you to close your right eye for me and follow along. Good. And now close the left eye and same thing. Good. Wonderful. Well, I would say so far, not concerned about your eyes in any way, shape, or form. And as I see from your last exam, you passed your color blindness test with flying colors. We're going to do a little bit of a different kind of color recognition exam today. Alright, so what I'm going to do is I'm going to hold up a sheet and you tell me what color it is, okay? Alright, both eyes on me. Here we go. And what color is this? Green. Good. Color is this? Red. Is your vision changed at all when looking through this? Good. And color is this? Blue. Very good. And how about this? Yellow. Very good. One more. Plain old white piece of paper. Wonderful. So far so good, my friend. Now we're going to actually take a look at those eyes a little more in depth. First, I'm going to start with a pupil exam. Going to cover one of your eyes. Okay. While it's covered, I'm going to swing the light in and out, just looking for that pupil response, okay? Completely painless. Very simple. You just have to sit back and relax. So, we're going to cover this eye and in, out, in, out, in, out, in, out, in, out, in, out. Great. And let's do the other side. In, out, in, out, in, out, in, out, in, out, in, out, in, out. Wonderful. Well, now I would like to take a look inside of your eyes real quick before we continue on with any more testing. Just going to grab my light here. I'm going to scoot real close to you. I'm going to use this light, as you can see, not super bright. Look in your eye and take a look, see what's inside. So just stay still for me. Keep that eye open and look straight ahead. Good. Look up. Good. Look down. Good. Look left. And now right. Good. Doing so well. To the other side. Take a look, take a look, take a look. Alright, look straight ahead for me. Good. And up. Good. Down. Right. And left. Great. Wonderful. Your ocular nerve looks well intact in both eyes. Not seeing any issues there. So there's nothing to be concerned about there, which is always a great thing. I would like to do a few more tests with you. So what we're going to do is we're going to use this pen light here. I'm going to hold my finger up here, and I just want you to follow it with both eyes. Good. Just keep following. If your eyes get heavy, that's okay. We've had patients fall asleep during this type of exam many, many times. Good. Good job. Wonderful. And now I would like you to follow the light for me. I'm going to cover one eye, similar to the pupil exam, but follow that light with one eye for me. Good. Just keep following. Good. Alrighty, let's do the other eye now. Here we go. Just follow that light. Good job. You're doing wonderful. I wish all of my patients were as easy going as you are. Truly, enjoy to have in my office. You're doing so well. Good. Alrighty. We are going to use the bright light a little bit, just to be ultra thorough. Now I'm going to back up for this, as this light is quite bright. And all I want you to do is follow the light, look straight at me, and follow this light with both eyes, and do not get distracted by anything I do with this hand. Pay attention to that light. Pay attention to that light. Don't get distracted. Don't get distracted. Focus on the light. Focus on the light. Focus on the light. Don't pay attention to the finger. Don't. Good. Good. Wonderful. You're able to maintain focus perfectly. It's just what I like to see. All right. So we're going to move back to the pen light real quick. And I just want to kind of check your depth of field with the light. So I'm going to start the light back here, and we're going to bring it in and then out. So just focus on that light going in and then out. In and out. In and out. In and out. Good. And over here, we do the same thing. Coming in and out. And coming back in and out. In, out. In, out. In, out. In, out. You are doing wonderfully. I would like you to follow my finger. Good. Tell me how many fingers you see. 2. Good. How many? Good. How many? Good. Good. Great. Tell me how many fingers you see when it crosses your vision. Getting 1 or 2 wrong is not a problem. Good. 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 Now let's see if you can do some rapid identification. So I'm going to hold my hand up. I'm going to flash a finger at you. You tell me 1, 2, 3, 4, 5. All right? Okay. Here we go. Ready? And 2. Good. 3. Good. 5. Good. 1. Good. 5. Good. 4. Good. 2. Good. 3. Good. Wonderful. I don't think I'm going to be able to stump you at all today. And that is a great thing. But so far, so good. Not seeing anything wrong with your eyes. So why don't we move on to those ears of yours? I'm going to grab my otoscope. And what I'm going to do first is take a quick visual inspection of each ear and look inside each one of them, see if there's any issues, which, based on what I've observed so far today, I doubt we're going to find any. So hold still for me. I'm going to come over here. I'm going to just take a look at your ear. And I'm gently going to just palpate around the ear. Okay. I'm not seeing any issues. And I'm going to take my otoscope here. Turn that on. Gently slip it inside. Take a look inside your ear canal here. Okay. Looks relatively clean. Tympanic membrane looks good. Good. Wonderful. Do the same thing on the other side now. Take a look in at the ear here. Palpate. Any pain? Good. And gently slipping the otoscope inside. Gonna just take a look. Same thing over here. Looks pretty clean. A little more wax buildup here. A little bit of irritation actually. You've been taking with the Q-tip. Don't do that. If you need an ear cleaning, please call us. We can handle it professionally and get all that wax out of there for you. Sometimes when you go in with a Q-tip, which is only meant for the outside of the ear, you'll actually push that wax deeper. And then you'll get an impaction, which can lead to an infection. And nobody wants that. So, no more stabbing Q-tips. I know it feels good. I know it gives your brain those little tingly brain gasms, but don't do that. If you want your brain tickled, you come to your doctor. We'll tickle that brain for you and get all that wax out safely. All right? Okay. Now that we know that your ears are in relatively good shape, I would like to do a few hearing tests on you. All right. So I want you to close your eyes. I'm going to make a noise in one of your ears, and you tell me which ear you hear it in, okay? Okay. Close those eyes for me. Here we go. Good. Great. Wonderful. Good. Good. Good job. Both. Okay. Open your eyes for a minute. And we're going to do another hearing test like that, except this time I'm going to get very close to you and I'm going to whisper a word in each ear. And you tell me what it is. Okay. Okay. All right. Close those eyes for me. Sleep. Good. Vacation. Good. Dream. Good. Tingle. Good. Coconut. Good. Pineapple. Great. Go ahead and open your eyes for me. Alright, so one more part of the hearing exam. I'd like to do a little tuning fork test with you. What I'm going to do is ring it, hold it up to an ear, and you tell me when you can no longer hear it. Alright? Alright. So I'm not going to hold it super close. I'm going to back up a little. But here we go. Keep those eyes closed. Good. Good. Good, and last one. Great. Keep those eyes closed for me. I would like you to tell me if you can identify this sound. Good. It is water. In glass, to be more specific. But you got it just right. Go ahead and open those eyes for me. I have to say, your ears are looking to be 100% perfect. So we have one more portion of this exam left, and that is the sensation test. So we're going to be asking you to close those eyes again. And to start, I'm going to start with touching you with a sharp object. This is not a blade. It's quite dull, actually. And then a soft object, this nice little brush. Alright? And I'm going to be touching you different parts of your face and your neck, and you just tell me, is it sharp or soft? Sharp or soft? Okay. Close those eyes. And here we go. Touch. Soft. Touch. Sharp. Good. Touch. Soft. Touch. Sharp. Touch. Soft. Touch. Sharp. Touch. Soft. Touch. Sharp. Touch. Soft. Touch. Soft. Touch. Touch. Both soft. Very good. Alrighty. And now I want you to tell me if it's the brush or the feather. Okay? So this is the feather. And this is the brush. Close those eyes for me. And here we go. Brush. Touch. Good. Touch. Feather. Good. Touch. Brush. Touch. Good. Touch. Brush. Very good. Touch. Feather. Touch. Brush. Touch. Good. Keep those eyes closed for me. And now we are going to go to another extreme where we have a warmed cotton swab here and a cold metal object, very dull. Will not pierce the skin, I promise. But you keep those eyes closed and tell me warm, cold, warm, cold. Here we go. Cold, good. Warm, cold, warm, good. Touch, cold. Touch, warm, very good. Touch, cold. Touch, warm. Touch, warm. Touch, warm. Touch, cold. Alright, my friend. Go ahead and open those eyes for me. I have to say, you passed that exam with flying colors. I can't see anything wrong with you, and for a routine checkup, that is the best news you can ask for. So I'd like you to take the rest of the day to relax, go home, put on your favorite show, and make sure you get plenty of sleep tonight, drink plenty of water, and maybe schedule an ear cleaning soon. And if you ever need us, we're here anytime. We'll see you soon. Have a great day. Bye-bye.